Good morning and welcome to this workshop with the HRB Trial Methodology Research Network and RCSI's Surgical Research Support Centre. And this morning we're going to be talking about surgical randomised controlled trials. We've already had a few technical gremlins behind the scenes, so hopefully that'll only affect me and won't affect the rest of the morning, because we have some really interesting talks coming up. We have some world experts who are going to share their insights in randomised trials with us. We have Professor David Beard from the UK first up this morning, and later on we have Professor Blaisby from Bristol. And I'm really looking forward to hearing both of their talks, because both of them are world experts in trials methodology. And then we're going to be hearing from people who've been undertaking randomised trials a little closer to home. A couple of recent trainees and current trainees have undertaken RCTs, as well as the current chair of the Irish Surgical Research Collaborative on her experience of setting up a collaborative multi-centre study. And then later on, Anne-Marie, our programme manager in the NSRSC, is going to fill you in on the supports we can provide for you all. I suppose just in terms of why we're talking about trials, I mean, it's been increasingly apparent as time has gone on that funding bodies internationally, be they scientific funding bodies or governments or health boards, really want robust data for any interventions they're going to pay for. And the most robust form of data they can obtain are from randomized controlled trials. So I've been showing this slide quite a bit, and those of you who've heard previous talks from me have seen it before. But this is some work that one of our SPRs in Galway has done for us in the last couple of months. And you can see that over the last 20 years or so, there's been an exponential increase in the number of randomized trials being registered on clinicaltrials.gov. We went on to have a little look at how many of those trials could realistically be labelled as trials that were Irish surgical trials. So these are trials in which an Irish surgeon, consultant surgeon, is the principal investigator. And it's the red line across the top of the screen. And I think if you compare the exponential curve we saw on the previous slides, you'd have to sort of say that the line of best fit for the red line here is really a straight horizontal line. So while the world is moving on with randomized controlled trials for whatever reason, within the Irish surgical community, we're sort of bumping along at our standard baseline. We're not following that exponential curve. And so in the NSRSC, we're keen to try and improve that a little bit if we can over the next couple of years. Surgeons always love a little bit of competition. So we did break it down by specialty. So the grey bars on here are the numbers of randomized controlled trials that we were able to identify on clinicaltrials.gov for each specialty. You can see that some specialties have a greater proportion than others, and some specialties aren't actually represented on there at all at the moment. So again, we'd be hoping to build on that over the next couple of years. And interestingly, when we checked how many of the trials have actually been published, only 1 in 3 of them is ending up with a publication. 44% of them are complete but unpublished, and 25% currently seem to be incomplete. So clearly there is trials activity going on within the surgical community in Ireland, but be fair to say that we could be getting more out of it for our patients and more out of it in terms of international impact. And so this is where myself and Anne-Marie come in with the Surgical Research Support Centre. Obviously lots of people have ideas for lots of trials, and we're going to be hearing from a lot of speakers in the course of the morning. again, my own personal experience has tended to be that you have an idea for a trial and it seems pretty straightforward on the back of the envelope with a sheet of paper. And as soon as you sort of step outside the room where you had the meeting with the back of the envelope into a morass of red tape, the whole thing nearly seems sort of too big to try and tackle. And so the support centre is very much being set up with the aim of trying to assist people with that, to make all of this sort of complexity seem much more manageable, and to just sort of navigate a way through it so that we see an increase in the number of completed trials for Irish surgical patients. To those of you out there, I mean, we're going to hear later, and Anne-Marie is going to fill you in a little bit on the current call we have out for feasibility trials. You know, if you're thinking of submitting a trial, I would just urge you to sort of consider a ladder of complexity in trial design. So I don't know if there are any plastic surgeons on the call, and I'm not a plastic surgeon, but our plastic surgeon colleagues do talk about the ladder of complexity in terms of you know, tissue reconstruction, ranging from secondary intention all the way to free tissue transfer. I think you can apply a similar ladder of complexity when it comes to randomized trials. So, you know, we start down here with sort of single center and simple intervention trials. So, for example, you know, do 2 different types of dressing have any effect on a wound infection rate? And you move up through the complexity, you know, you move up, you can have a single center trial, but considering a much more complex intervention. You can move on to multi-center trials, but maybe within one jurisdiction and looking at a simple intervention before you try a multi-center trial with a more complex intervention in one nation. Before you sort of get up to the top of this and start trying multinational complex intervention trials. So to those of you out there who are thinking you want to get into trials and start doing some trials, you know, I would just urge you to consider in the first instance, maybe thinking about starting down here or starting with a multi-center simple intervention. Obviously our aim in the Surgical Research Support Centre is to create a surgical trials network, and again, Anne-Marie will speak to this a little later on. And you know, hopefully within sort of about 3 to 4 years, we would aim to have a functioning network that will fit in with the existing sort of national clinical trials infrastructure, which the Health Research Board has very sort of painstakingly built up over the last 10 or 15 years. You know, so we're here and we're available to try and sort of help people interact with their local clinical research facilities. We're sort of building connections with the other clinical trials networks in the country, but it's all with the aim of ensuring that there is a jigsaw piece labeled surgery that is able to slot in here in 3 years' time, so that surgical patients are gaining all the benefits that they can gain in Ireland from taking part in high quality randomized controlled trials. Just again, for those of you who want to get in touch, Anne-Marie and myself are always happy to accept emails, and the email addresses are there. Any of you want to get in touch, we'd be delighted to hear from you. And if any of you are thinking of putting in a submission to the current feasibility trials call, we really would urge you, you know, please get in touch with us before putting a submission in. You know, we're very keen to try and help people produce or submit the highest quality submissions that they can. So please get in touch, don't be shy.